which is just to remind everybody, this is not a public board meeting. We're very grateful for those of you that have dialed in and are attending the meeting. All questions have to be submitted in the time frame as designated by the board, and we will be making a recording of this available, and that will be on certain platforms, Iram, which you can remind me which are in which way can people actually view this on the recording.
So the board meeting will be published on our YouTube channel.
Lovely. Okay, thank you. Okay, apologies, please, Iram.
So we've received apologies from Lynn Dalton and Rachel Joyce.
Okay, and we know that I think Jane Halpin and Alan Pond will be joining us a little bit later. Is that correct? Yeah,
that's right. Yes.
Okay.
I'm here, Nicholas.
Sorry,
I'm already here, Nicholas.
Oh, fine. Sorry, Alan. I didn't realize you were there.
No
Thank
problem.
you. Okay. Interest to declare.
So I have no conflicts of interest noted for this meeting.
Okay, and just to remind those that are watching this that all of our register of interests are on our website under the Managing Conflicts of Interest later. Before I actually move on to the minutes of the last meeting, I think very important just to mention the people that will be leaving us as an organisation. So we're delighted both for Avni and for Lynn Dalton that they will be taking up the roles within the joint management team. So congratulations to both of those, but that does mean that they will be joining our board in their different roles. And we also have to say goodbye, first of all, to Tracy Brown, who actually I think had her leaving due yesterday, and has been a great input to the nursing and quality team, and also to Rod Weil, who has been on secondment over at West Herts and has decided to leave us. So Rod and Tracy have been fantastic members of our team and given great support, particularly Rod in particular to our governance, Tracy to our nursing and quality. So really wish them very, very well, good wishes for the future. So if I now move on to the minutes of the meeting that was held on Thursday, the 24th of September. So first of all, for accuracy,
Nicholas,
so I'm not actually going to list the pages, but is there any points of accuracy that need to
Nicholas, if I can just say, it's Juliet here.
Hi, Juliet.
I was actually at the meeting, and I'm my comments are noted, but I'm not listed in the in the attendees list.
Thank you for noting that one. Okay, you were definitely there, absolutely. Any other points of accuracy? Okay, I'm going to take that as nothing. And do I have the board's approval? I'm getting nods all round. Thank you very much. Okay, so moving on now to the matters arising and the action log. There are actually only 3 items on the action log, and the first one, which is open, Hein is going to provide us with an update at the meeting. The other 2 have been completed, and the actions are closed. Iram, is there anything else we need to say on that?
No,
just getting
that's so perfect. No,
that's okay. Okay, and then very importantly, next one was questions received prior to the meeting from members of the public. Iram.
Nicholas, sorry, I can provide an update on that action if you wish.
Okay, fine. If you want to do that now, that's fine. So
that relates to a request from Alison Gardner in terms of the infrastructure that we've put in place following COVID's first wave. We have now appointed 7 people that mans the incident control center that is headed by our ICC manager. We have a dedicated team looking at all the relevant issues, including the EU transition process, the vaccination process, and PPE. So we have a much more structured and stable infrastructure to deliver as we move forward.
Okay, thank you very much. Okay, so back to just were there any questions actually by the deadline, Iram?
So no questions came in relation to today's meeting.
Okay, thank you. Then the next item is the minutes from the private board session held on the 22nd of October, and this is an attachment for information. The reason why it's very important for us to be to talk about this in the public arena is that the actual discussion that we had, which was a very rich discussion, we felt it was incredibly important and right that that was put into the public domain. So for anybody who wants to read that, and you can see the very detailed discussions that we had, the reason why we had to do this was because we had a deadline that we had to actually respond to, and we didn't have a board meeting in public to be able to discuss it. But the fullness of the discussion, I really feel, is included in the minutes. But is there anything that anybody would like to say on that before we move on? Okay, thank you. So that really stands there, and I think there's a lot of actions within that that we'll be following up. Okay, so I now move straight on to David to talk about his CEO and Managing Director's report. So over to David.
Thank you, Nicholas, and welcome everyone to the public meeting. I'll update on behalf of Jane and myself throughout this report. Everybody has a copy of it, so I will try and pick out the key areas. But in relation to the integrated care system and developments, the main focus of work across all of the three CCGs and the ICS has continued to be around COVID. I don't think anyone will be surprised that our focus has been on managing the work that's required to continue to run the NHS to offer the full range of services at the same time as managing and treating those with COVID symptoms and reducing the waiting lists and bringing services back online since the spring. There's been detailed work taking place as well around the vaccination plans, and as we know, the clinical trials are now demonstrating that we have potentially 3 vaccines that will be able to be rolled out over the coming months. And we are working with our partners in the local authority, district councils, voluntary and community sector, and within the NHS to ensure that we have robust plans in moving those programs of work forward so that we're prepared when the vaccines are able to be rolled out. In terms of ICP meetings, so Jane and the team, the ICS Joint Exec team, have continued to meet in all of those areas around development of the integrated care partnership teams. Each of them now is moving at considerable pace. In East and North Herts now, it's clearer that the joint leadership arrangements across CCGs and PCNs, as well as the partners, is progressed significantly. So we feel that we have a platform now that we can work on locally in each of the local places to develop the services so they're robust into the future. More formalised system leads meetings are now taking place with chief execs across the system in terms of partners. The partnership board now has been up and running for 2 meetings and feels like we are now gathering a momentum and structure that will enable the organisations to work collectively to the common goal. Still challenges that we need to manage around system activity and system finance, but the mere fact that we're now working collectively within a structure has enabled those priority areas to be focused on alongside digital. As ever, regional meetings continue and the structure is as ever moving forward in terms of its transformation. Informal meetings always take place, as you know, and I think it's important that we recognise that the CCG chairs and managing directors have begun work on looking at how a single CCG would operate and develop over the coming months. There are plans that align to NHS England's future direction of travel, where CCGs will be looking to merge at some point, and I don't think that's a new agenda. It's something that we've been working on for a while. Plans will become more clearer in the next month or two, where we know, I guess, the position that NHS England is taking and government are in relation to health services into the future. We are linking in closely with our partners at Healthwatch Hertfordshire as well around current issues to do with patients, and we're improving and hopefully going to bring on the development of lay and non-exec directors into the structures, as we've always talked about. And from Hearts Valley's perspective, that is something that we would strongly support. The joint executive team continues to develop, and as Nicholas spoke about earlier, some roles have now been appointed to the 2 posts of Director of Primary Care Transformation and Director of Primary Care Contracting are now in place, as that's Avni Shah for the transformation role, and the contracting role is Lynn Dalton. Also appointed to the performance delivery role recently. We'll be making public the individual who has been appointed to that role as soon as we can. But we would like to thank, and personally I would like to thank, as Managing Director, all of the hard work that Avni Shah and Lynn Dalton have put into our local patch. And I think we can all say that we're really proud to have seen them develop into their new roles, and it will be a fantastic addition to the team, and I look forward to working with them both. And alongside Rod and Tracy Brown, who will be leaving the organisation, just to thank them publicly for their hard work over the years. The CCG would not have run as smoothly without them. So some really positive grounding of the organisation now. The joint exec team can move forward, and we'll be developing what will be our team plan over the next month or two. Recovery and restoration. So as we know, we've moved back into a level 4 incident, and what we've done is taken some of the learning from the previous level 4 response. And what we have done is restructured some of our working arrangements internally. Nothing huge, but we did realise that the balance between incident management and recovery was always a fine line with this clinical commissioning group, and the level of resource that we had and where we focused our individuals. So in the first wave, employed individuals to support the hot hubs, support 111 and within the hospital. This time the resilience is a bit stronger, but what we do need to do was ensure that we had incident management and recovery completely connected, because one can overbalance the other at any time. So we made some small adaptations to our structure, and you can see those in the appendix within the paper, and we've tried to complement the incident control centre work that we're doing alongside our recovery. Much more tighter multidisciplinary team working now, and I think what we've done is improve the connectivity within the CCG, and we've now developed what is a tactical response and incident management group. I'm happy to take any questions on that as we go into the Q&As at that point, but just a slight tweak to what we're doing, nothing huge, but enough that we've learnt from the previous wave to improve the way in which we operate over this period of time. And what it has done recently is demonstrated that it's been very successful in helping us support West Herts currently with the capacity issues they're having within their hospital, and how we can support discharge of COVID positive patients, which has escalated over the last week or two. In terms of operational areas, you'll see that the primary care in the localities has been doing significant work over this period of time. I'm not going to go into detail on all of this, but I think it's fair to say that the primary care has been under significant pressure, but also had lots of pushes and pulls in terms of expectations of it. Around GP enhanced commissioning framework, we've had to work pragmatically with our partners in primary care to ensure that we enable them to be agile and deliver the services, and we ensure that the money and resources gets to the right place so that patients aren't without service. And I think primary care has stepped up considerably to this challenge, and as an organisation we're trying to ensure that we are being as pragmatic as possible to continue to support primary care through what is a very challenging time. But as you can see, there's access to general practice appointments have continued, and we have seen them improve in terms of face-to-face appointments as well. But the virtualisation of care has been fantastic during this period. So a big thank you to everyone in primary care. We do know that we have additional roles that are coming online within the PCNs. They were required to submit their roles for the reimbursement scheme, and therefore we're starting to build teams around primary care and primary care networks that will provide additional support above and beyond what would be the standard core offer. Early cancer diagnosis, and I'll pick that one out. The PCNCDs were invited to attend a webinar held by Cancer Research UK. This really offered resources and way in which we can continue to improve our performance. And you'll see that we are showing some signs of improved performance in cancer, but it is still one of the areas that we need to do better on as a collective health system, and we are working to progress that. Vaccination program for flu. I'm sure members of the public would be interested to know that this is well underway now and is largely where Hearts Valley CCG would expect to be at this time. In terms of data, uptake is above last year's achievement to date, and all indicators and October trigger points have been met for the over 65s. So a really good response to flu vaccination, which we know is very important during this period of time, during the COVID world that we live in. Plans are in place around the COVID vaccination program. I've talked a bit about that earlier, alongside restoration and recovery. So there are key highlights that I wanted to pick out in terms of primary care. Community resilience. We know that our small grants process now has been agreed. All 54 projects worth over 400,000 are now signed off, and providers are working to implementation plans. Really good cited as a really good practice, this process of how we can sustain our voluntary sector and ensure that they're supporting the healthcare needs and social care needs of individuals in our communities. And so we will continue to push on our social prescribing model, which has already increased. So in Harpenden and Dacorum, the PCNs now have their second social prescriber and link worker under the DES, and that is now operational, and they'll be recruiting to more throughout our patch, and hopefully this will provide significant support to the residents and population of West Hertfordshire, whose needs are balanced between health and social care, but often just need to know where to go, get some help, and have their hand held through some difficult times. And we know those times are more difficult than they've ever been recently. Also, work on carers has continued. That's how the CCG has now ensured that all of our staff have access to Employers for Carers information, which is via the Wellbeing site, and in partnership between NHSE and Carers UK. So something that's really helpful while staff are continuing to be challenged in their working environments. And we've done lots and lots of work around health and wellbeing in that space. Planned care, planned care has been focused mainly on the restoration and recovery of acute and community services. As ever, we've identified the areas of transformation that need to take place. We've taken an adopt, adapt and abandon process, and that has really enabled us to work at an integrated care partnership level with our partners, providers, to decide how the best way forward is. And I think our referral process is seen as a good practice and best practice model, which I think from a conversation I had this morning will be rolling out in the other two patches of our ICS as part of a supportive way to get referrals back online for all of Hertfordshire and West Essex. West Arts are now working closely with the independent sector as well to increase capacity. We know that during this period of winter, beds will be under pressure. Planned care needs to be delivered, so we will continue to expand the capacity in that area as much as possible so that patients aren't waiting long enough. The challenge in this patch was always that whether COVID would have more of a negative effect on patients' health and well-being, or the fact that people were having delayed healthcare treatment, and we need to make sure that we don't see that as we move forward into the new world. Urgent care, over the last few months, we have seen an steady increase in volume attending A&E. We are coming to winter, and I think it's important for the board to be aware that we will still see those winter pressures that we've seen every year, year on year. And so with that, alongside COVID positive patients coming into the hospital, we are seeing a challenging bed base that needs to be managed and having to re-engineer some of our discharge pathways. So historically, we would look at moving people into rehab, into nursing homes or residential care. Now we have to also think about how we can discharge individuals who are COVID positive out of a hospital into a care setting, still retain their rehab needs, and when they're able to go home and become COVID negative, they're able to be safely transitioned. And some of that is proving a challenge for the system at the moment. The teams are working fantastically on that to push the work forward, and it's been a focus for the last couple of weeks in the CCG. Urgent Treatment Centre at Hemel and Watford over the last few months has seen a steady rise in activity. Both continue to deliver well above the 95% for our standard though, and as you can see, Hemel is at 99.9% and Watford is at 99.2%. So these have really helped decompress some of the pressures in A&E at Watford General, and we know that they'll both be playing a role in the new Think 111 implementation coming forward in the next few months. And this is a significant piece of work, and it will mean that we'll be able to develop a standard operating procedure with West Herts and Herts Urgent Care, which will redirect bookings into the emergency department. So same day emergency care and urgent treatment centres will be supported through this Think 111 first model, and hopefully this will again improve flow and support the capacity required to decompress some of the challenges in the hospital. And also, as you'll see, children and young people, Hertfordshire's children and young people wide strategy is now being developed, focusing on the design and implementation of the Healthier Together plans. Lots of work around our paediatric transformation program. The work that Rami and the team have done in the CCG has really got us into a good platform, and I know the board is committed to having this and retaining this as a priority, and so is the integrated care system. We're having conversations as a joint executive team next week about the best way to implement this and how we can partner up with our county council and district council colleagues so that we have a joint commissioning approach to all of our children's services. The areas of focus that we've agreed in our own plans are the single point of access for children. We want to review options for improved care coordination in planned and acute care, and we definitely want to focus on the review of end-of-life provision. And so there's a significant piece of work we need to do locally alongside the challenges of managing pathways across health, social care and education. I think it would be remiss of me not to talk about CAMS, Child and Adolescent Mental Health Services. We're still implementing our CAMS transformation plans. Referrals for mental health support for children and young people have increased since September. We expected this. This was always going to happen when children and young people went back to school. The outcomes of the challenges of managing COVID and being off school was always going to impact later on down the line. So a focus group was held with young people in October to ensure that the virtual support has been designed to meet their needs and communicated effectively. And what we've known is that some of our virtual offers to children has gone down really well. Uptake is high. We have a system called Couth that we fund, and that has been fantastic in ensuring that people have had access to care and support around their mental health at varying times of the day, because we all know that while children are at school and families are at work, actually sometimes the space that the young person needs